How to use disposable insulin pen safely. Step 1. Check the Sustagler pen. First, check the pen's manufacturing and expiry date. Always ensure the insulin is within the valid period before use. Step 2. Mix the insulin. Hold the pen in your hand and gently roll it between your palms to mix. Then, tilt the pen up and down at a 90 to 180 degree angle several times. Check for air bubbles and make sure the insulin looks clear. Step 3. Clean the cartridge tip with an alcoholic wipe. Take a new insulin pen needle and carefully attach it to the pen. Remove the outer protective cap, keeping it aside for later. Avoid touching the needle tip to keep it clean and ready for use. Step 4. Gently tap the pen so any air bubbles rise to the top. Prime the pen by selecting 2 units. Then press the injection button until a drop of insulin appears at the tip. This ensures the pen is ready for use. Turn the dial and adjust the pen to your prescribed dose. Step 5. Clean the injection site with an alcohol swab. Pinch the skin gently. Insert the needle at the correct 90-degree angle and press the injection button fully. Hold the needle in place for 10 seconds to allow the insulin to be delivered properly. Step 6. After injecting, remove the needle carefully. Place it back into the outer cap and discard it safely in a sharps container. Disclaimer: always use insulin that appears clear. Do not use if the solution looks cloudy or contains particles. Follow your healthcare professional's advice for correct technique and dosing.